I'm going to be your student nurse today. I'm going to be performing your head-to-toe assessment. So, can I have your name?
Salvador.
Can you tell me the year?
2025.
Can you tell me where you are?
At home.
Can you tell me why you're here?
For my head-to-toe assessment.
Okay. Patient is alert and oriented ×4. Patient is alert and follows commands. Patient is well-appearing, not in distress. Patient's behavior is consistent to the situation. General movements are symmetrical. Can you smile for me? Face is symmetrical. Pupil size is 3 millimeters, equal bilaterally. I'm just going to shine this light into your eyes really quick, okay? Pupils are equal, round, reactive to light, both direct and consensual with accommodation. Speech is clear. Crude hearing is intact. I'm just going to have you get up and walk to the door and back to me a couple times, okay? So walk to the door normally. Walk back on your heels. Walk back on your toes. And walk back in tandem. Gait is smooth and coordinated. I'm just gonna run a light alcohol or cotton swab over your. So just close your eyes. Tell me now when you can feel it, okay?
Okay. Now. 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 Now.
Light touch sensation, bilaterally intact in both upper and lower extremities. Moving on to the cardiovascular system. No visible heaves, lifts, or pulsations. I will be assessing the 5 precordial sites with both my bell and my diaphragm of my stethoscope. So I would auscultate the aortic site, right sternal border, second intercostal space, the pulmonic site, left sternal border, second intercostal space, herb space, left sternal border, third intercostal space, tricuspid, left sternal border, fourth intercostal space, and the mitral, left midclavicular line, fifth intercostal space. My findings would be S1 and S2 are present, no S3, S4, or murmurs present ×5 precordial sites using both the diaphragm and the bell of my stethoscope. For my apical pulse, I would listen to it located in the left midclavicular line, fifth intercostal space. I would listen for 60 seconds, and to which my findings would be it's 96 beats per minute with a regular rhythm. Now moving on to your peripheral vascular system. Skin is consistent with ethnic background. No masses, no lesions on both arms and legs. Both arms and legs are symmetrical bilaterally. I'm going to palpate. And both the skin on the bilateral arms and legs is pink, warm, and dry. Now I'm going to take your capillaries. Capillary refill. Capillary refill is less than 2 seconds. I'm going to see your pulses. Okay, your pedal pulses. Okay, so radial and pedal pulses are present +2 bilaterally. I'm going to check for pretibial edema by pressing down the ankle. No pretibial edema present. Now I'm going to move on to the respiratory system. So there's no cyanosis, no masses, no lesions on the anterior chest. The thorax is elliptical in shape, symmetrical. Your respiratory rate is going to be 19 breaths per minute. Your respiratory pattern is going to be regular, unlabored. Your work of breathing is going to be eugenic. I would then palpate right here. Do you feel any tenderness?
No.
The skin is warm, no tenderness, no lumps. Then I would see your trachea. Let me see your trachea. Trachea is midline. Then I'm gonna auscultate. Okay, now you can turn around. Oh, lung sounds are clear. No adventitious found in the anterior chest. Okay, again, no cyanosis, no masses, no lesions on the posterior chest. The shoulders are symmetrical. If I palpate, the skin is warm. Do you feel any tenderness?
No.
No tenderness, no lumps. Then I would auscultate. And all lung sounds are clear in all fields, no adventitious sounds. Okay, so now I'm gonna look at your GI. So just open your mouth for me. Okay, teeth are white and straight. Buccal mucosa is pink and moist. Gums are pink and moist, no bleeding. Tongue is pink and moist. Hard palate is white and moist. Soft palate is soft or pink and moist. Put your tongue down. Tonsils are present, +2 bilaterally. No halitosis is present. Now I'm gonna do your abdomen. So if you could just come over here and lay down. Let me move the camera. I'm gonna lift up your shirt a little bit. Okay. So, skin is consistent with ethnic background. No masses, no lesions. Abdomen is symmetrical. Contour is flat. Umbilicus is midline. Skin turgor. No turgor is brisk. No tenting. I'm gonna listen to your bowel sounds. Bowel sounds are normal, active ×4. Now I'm gonna do some light and deep palpations. My patient is a little ticklish, so I'm gonna use his hand or mine. Deep palpation. Did you feel any tenderness?
No.
No tenderness upon light and deep palpations. So now let's do your musculoskeletal system. I'm just gonna have you sit up on the bed, okay? For right now. Okay, so I'm gonna have you open your jaw, or let me just feel first. I'm gonna feel your TMJ, I'm gonna feel your cervical spine, shoulders, elbows, wrists, fingers, hips, thoracic spine, lumbar spine, hips, knees, ankles, feet, toes. No tenderness upon palpating the TMJ. the cervical spine, the thoracic spine, the lumbar spine, shoulders, elbows, wrists, fingers, hips, knees, ankles, and feet. Now we're just gonna test for your range of motion, okay? So you're just gonna do what I do, okay? So open your mouth. Okay, full range of motion and the TMJ for your cervical. Okay, full range of motion in your cervical spine. For your shoulders, go ahead and stand up a little bit. Full range of motion in the shoulders for your lumbar and thoracic. I'm gonna go like this. Stand up, go. Stand. No. Go back. Okay, lateral. And then this. Okay, full range of motion in the thoracic / lumbar spine. Now for your hips, I'm gonna have you lie down, back down again. I'm gonna have you extend. Rotate into externally. Scoot up a bit. Okay, then you're gonna push this out, push this in. Again for the other one. Okay, stand back up. Sit down. Okay, for your knees, you're just gonna extend. Do the other one. Okay, full range of motion in the hips, full range of motion in the knees. For your feet, you're gonna go like this, this, this. Okay, for your toes. Okay, full range of motion in the ankles and toes. For your wrists now, or your elbows. Let's see your elbows. Go like flex. This. Full range of motion in the elbows. For your wrist now, go like this. Like this. Like this. This. Invert. Invert. Abduct. Adduct. Put your fingers down. Put your fingers down. Full range of motion in the wrist and fingers. And so full range of motion for all your musculoskeletal joints. So that will be it for your head to toe assessment. Thank you for letting me take your head to toe, okay?
Okay, thank you.
Okay.